Today I'll be performing a wrist real time for you guys. During this real time, we're going to start with palpations. So first we're going to start by palpating the radial styloid process. That is the bone of the wrist on the thumb side of the hand right here. Next we will have the patient extend their thumb, and these two tendons that pop out make up the anatomical snuff box. The top ligament that sticks out the most is the adductor pollicis longus, and this extensor is the extensor pollicis brevis, and we will palpate within these two ligaments to palpate the scaphoid bone. Right, next we're going to move to the dorsal side of the wrist, and we're going to palpate the carpals here, and in between the carpals to the metacarpals we can palpate here for the CMC joints, and then we can palpate up the metacarpal bones to the metacarpal heads here, which are your knuckles. Next, we're going to move to the pinky side, and we can palpate the ulnar styloid process, which is this wrist bone here. From the ulnar styloid process, right above it in this joint space is the TFCC, and we can provide pressure here to indicate fovea sign, or to perform fovea sign, which would cause pain to the patient if there was a TFCC injury. Next, we're going to move to the palmar side of the hand. Right here above the wrist is a little small circular bone called the pisiform. Slightly above it is the hook of the hamate, which might be tender when applying pressure. Then we're going to palpate the lunate, which we're going to move medially from the scaphoid here and palpate the lunate. Okay, next we're going to be performing range of motion. So I'm going to have the patient perform active range of motion of the wrist. We're going to start with flexion, bend your wrist forward, all the way forward, okay? And then we're going to do extension, bend it all the way back. And then we're going to have them do supination, hand palm up, there you go, and then palm down for pronation. And then we're going to have them perform ulnar deviation, move towards your pinky, and then radial deviation, move towards your thumb. Okay, then we're going to manually muscle test these motions. So to manual muscle test the flexors, we'll have the patient go into flexion, and then don't let me break you out, okay? That will test the flexors. Then we'll have the patient go into an extension, and don't let me push you out. There we go. And then we'll test the ulnar and radial deviation. So go towards your pinky side, yeah. Don't let me push you that way. And then go towards your thumb, and don't let me push you in that way. There we go. Now we're going to do passive range of motion. So I'll have the patient relax, completely relax, and I will perform these motions for them. So flexion, extension, ulnar deviation, and radial deviation. While we're here, we can go ahead and do the wrist varus and valgus. So for valgus, we're going to be testing the radial collateral ligament by applying pressure here, a valgus force, and then we can test the UCL of the wrist here by applying overpressure and a varus force. Next, we're going to perform the special test. So we're going to start with the Watson test, which is for scapholunate dissociation. So we're going to palpate the lunate from the scaphoid. Remember, we started at the thumb side and we moved medially. We're going to apply pressure dorsally, and then we're going to have the patient ulnar and radially deviate. And if there is a shift of the lunate away from the scaphoid, this indicates scapholunate dissociation. Also for the lunate, we'll have the patient do Murphy's sign, which will have them make a fist, and we will see if make sure this bone sticks up above the rest, this knuckle. If they were all even, and that would indicate that the lunate is dislocated, and that would cause this to depress. Next, we're going to do the Finkelstein's test. We're going to have the patient make a fist and place their thumb inside, and we're going to provide overpressure and ulnar deviation to put the anatomical snuff box ligaments in a stretch. If this causes pain, this would indicate de Quervain syndrome. Next, we're going to do Fallon's test. We'll have the patient place their hands like this. If in this position there is numbness or tingling, this would indicate ulnar nerve or nerve pathology. Next, we're going to do Tinel's sign. We will repeatedly tap within this carpal tunnel on the median nerve, and that would indicate a nerve pathology as well if it elicits any numbness or tingling. Lastly, we will ask the patient if they have any numbness and tingling. If so, we will perform a neurological exam for C5 through T1. We will also check vascular capillary refill as well as distal pulse to make sure that is intact. That completes our real-time evaluation of the wrist.